blood tests are just not very reliable. So what I'm going to share with you today is my experience as a board-certified internist. I have seen at this point over 12,000 chronically ill people in the last 27 years, and my goal has been to find out why you are sick. And the problem is that the guidelines that you're going to read about, at least through the infectious disease doctors, they only published on Lyme disease. And the major reason that my patients don't get better is because they come in with up to 16 reasons why they stay sick, and that's what I'm going to show you today. It's literally like going into a doctor's office with 16 nails in your foot, saying to the doctor you have foot pain, and the doctor pulls out one nail, which is Lyme. You come back a month later and you say, I still have foot pain. The doctor didn't find all the other reasons why you're sick, and I'm going to go into that in great detail with you and actually show you how science can bridge the gap, because Lyme is not just a medical disease, it's a political disease, unfortunately. And I was just at Harvard doing grand rounds at Mass General this past week. Alan Steer actually approved by CME credits the slides I'm about to show you today. So I just want you to know that I think the two sides are coming together, and that my goal at this point is to bridge the gap, because the United States cannot suffer any more illness the way I'm looking at it. These chronic illnesses, Alzheimer's is about to triple in the next 30 to 35 years. Nobody can tell you what Alzheimer's is, except they found Lyme spirochetes through Alan McDonald in the NIH data bank, where 70% of the Alzheimer's patients in the NIH data bank had spirochetes, had Lyme in their brain. Now that doesn't mean Lyme caused Alzheimer's, but what it might mean is that there's inflammation in the body caused by infections. There was an article that was just published in Mexico. Young children at 14 years old who died in a car accident, they did brain biopsies and found Alzheimer's plaques in their brain at 14 years old because they had environmental toxins. It's one of the most toxic areas in the world. What's happening is we kind of have taken medicine and thought about it as if there's one cause for one disease. And I'm going to show you today that Pasteur's postulate that they taught us in med school, it's just not applying to diseases we're finding in the 21st century. And I think when you look at autism, 1 in 88 is now 1 in 68. We don't know what causes autism. The cancer rates in America, there's a 40% prevalence of cancer in America. Nobody knows. Is it viruses? Is it toxins? I'm going to show you today a model that I think is not just for Lyme, but for many of the chronic diseases, and will hopefully help our country to get out of some of the problems that we're having right now. Now, you've seen this slide, and the interesting part is Holly and I did not look at each other's slides before we did this talk. And this is exactly pretty much what happens is people come to see me, they see 10 to 20 doctors, literally, before they see me, telling me that it's in their head. They can't find a reason why they're sick, and since the doctors don't believe in it, they call it chronic fatigue or fibro or some other disease. So let me just give you an overview of what I think is happening in this country, which is very important to keep in mind. So chronic disease accounts for 70% of the deaths and 75% of the healthcare costs in our country, and yet the interesting part is we don't have a model for chronic disease in this country. So it's 75% of our healthcare costs, and no one has a model. I'm going to show you that model today that I think really needs to be studied in detail. Lyme disease is the #1 spreading vector-borne epidemic worldwide. It mimics other chronic diseases. The CDC did increase the numbers by tenfold, but if you actually look at the Hook study that was published around that time, it was 0.3% of the American population, which is closer to 1 million people. So it's not actually 300,000, it's actually more, and as Holly told you, they were using two-tiered blood testing, which roughly gets about 50% of the people. And some of the states weren't even reporting in this particular study. There's confusion regarding the diagnosis and treatment of Lyme because of these two standards of care. And unfortunately, politically, really what doctors should tell you is that there are two standards of care, not one, and should explain to you what both of those standards of care are. Because unfortunately, even though I respect the IDSA researchers, I think some of them are brilliant researchers, they were just talking about Lyme disease. And that is not what you are coming into my office with generally. And that goes back to the definition. When you call it chronic Lyme disease, it really isn't chronic Lyme. The word Lyme disease, when the health departments are looking at it, they're doing it from a surveillance definition. Okay? Their job is to epidemiologically screen large populations of people to make sure that definition is really precise. The problem is that it doesn't encounter what I see in my office, and I'm going to propose to you a new definition, which is called Lyme MSIDS. And MSID stands for Multiple Systemic Infectious Disease Syndrome. Because, as Holly was telling you, the patients who come to see me don't just have Lyme. They have Ehrlichia, they have Anaplasma, they have Babesia, different strains, they have Bartonella, cat scratch fever, they have different viruses, and they've got Babesia, this parasite that's getting in, that's making them very ill. And I'm going to spend some time on that today explaining to you, because Babesia, this parasite, is probably the #1 reason as far as co-infections why many of my patients are staying sick. Regarding diagnosing Lyme, I'm going to show you the science about the serology and why the blood tests are inaccurate. And again, this is all published in scientific peer-reviewed literature. I'm not expecting you to remember it. But what you will remember when you're done here today is that Dr. Horowitz showed you slides published in peer-reviewed literature, and these are all in the hundreds of references in the back of my book so that you can bring to your doctor and show them there is peer-reviewed science. As far as treating Lyme disease, what is the evidence of persisting chronic infection, and do we need longer treatment courses? Yes, we do. I've treated 12,000 people, and I can tell you that 30 days of antibiotics does not work in people once they go on to a persistent state. What it comes down to, and this is the key of my talk today, is that it's infection from Lyme and associated tick-borne infections that's causing inflammation. And inflammation is the #1 common denominator in all chronic disease. This is the interesting part about what we're missing in the model in the United States right now, is I'm going to show you that for rheumatoid arthritis and lupus and strokes and heart attacks, it's all based on inflammation. It's not the cholesterol in your arteries that's the problem, it's the oxidized cholesterol that gets in there that sticks. So we have to look at this inflammatory process. It's like having a fire in your body that needs to be shut off. That is part of the problem in many of these multiple diseases. So when I diagnose and treat what's called the 3 I's, chronic infection, inflammation, and immune dysfunction, and there is, by the way, immune dysfunction. Alan Steer was right. There are autoimmune phenomena taking place. But the problem is I'm finding these other tick-borne infections, not just Lyme, are also causing some of that autoimmune response. For example, mycoplasma has been published in the literature to cause autoimmune reactions. Mercury, that I'm finding a lot of people as a toxin, causes autoimmune reactions. But again, doctors don't think as far as multifactorial causes causing the same exact problem. So this multifactorial model for chronic disease called MSIDS is what I'm going to show you here today, and show you in my practice that when I've treated multiple factors on this MSIDS map, we've helped decrease inflammation and reduce disabling symptoms. And that is the hopeful message that I have for you today, that even if you've been sick for a long period of time, I'm going to show you how I get my patients better. Now, how do you know as an internist that you have Lyme disease? Well, actually, it's quite clear if you know how to take a proper history. The symptoms come and go. You have good and bad days. The joint pain and the muscle pain tends to migrate around your body. Now, not always, but many times. One day it's in your shoulder, 2 days later it's in your knees, 3 days later it's in an elbow. How many people here have migratory joint pain? Quite a few in the audience. There's no other diseases that cause migratory joint pain. If you're an internist and you're asking this, it's not that it hasn't been published for gonorrhea or mycoplasma, but Lyme is the only clinical disease that causes it to move around your body. What about nerve pain? That tingling, numbness, and burning sensation, you have that. Great. How many of those of you who just raised your hands, does it move around your body with a tingling, numbness, and burning, goes to different parts of your body? Well, if you've got carpal tunnel syndrome, right, your nerve's been affected, it doesn't move around, right? Migratory, this is something that tells you you have Lyme disease. Women will tell me during their hormonal cycles, right before, during, or after their menstrual period, they get much worse. And if you take an antibiotic, like the patient just told me yesterday, I was with Congressman Gibson yesterday at the meeting, he showed up for the Lyme forum and where we were yesterday. One of the patients came up and said, you know, I took an antibiotic for urinary tract infection and I got much sicker. All of my fatigue and my joint pain got worse. That's a Herxheimer reaction. Where some people, conversely, will tell you they feel terrible with joint aches and muscle pains and headaches and fatigue. They take an antibiotic, they feel better. For an upper respiratory infection, they stop it. The symptoms come right back. So antibiotics, if it increases or decreases your symptoms, tells you you may have an infection in your body. If you have very severe pain, resistant neurological pain, where you're on drugs like Neurontin, Elavil, Cymbalta, morphine, and your pain is still not controlled, Lyme and associated tick-borne infections can be causing this. I had a patient from the Midwest on 480 milligrams of morphine and multiple drugs. He had been to 9 rheumatologists, given methotrexate, given prednisone, given Arava, Enbrel, every rheumatological drug they could think of. His pain didn't get better. When I treated his Lyme, his Babesia, and his Bartonella, I got him off every one of those drugs. He's now well. So resistant neurological pain that doesn't respond to drugs. You may think that you may have Lyme disease. And finally, now here's the science, and you're not going to remember all this, but I just want to show you that science shows that the testing is unreliable. Mangaroni published in 2005 3 different ELISA tests. It picked it up between 36 to 70% of the time. DiMartino published in 2007 14 different ELISA tests, picked it up between 20 and 97% of the time. Then there are the different species of Borrelia. I'm going to show you a new species of Borrelia called Borrelia miyamotoi, a relapsing fever spirochete. It's not picked up by an ELISA, not picked up by a Western blot, and yet it causes Lyme-like symptoms. So is it possible that some of your Lyme-like illness is due to other Borrelia spirochetes? Yes, in Europe they've got this problem. They've got Borrelia abzelai that causes a rash on the hands and feet called acrodermatitis chronica atrophic hands. We have very little in the US, but occasional. They have Borrelia guarini that causes neurological Lyme. And then they've got Borrelia spilmani and Borrelia valsana and all these other strains, Borrelia lusitania. There's 100 different types of Borrelia in the US, 300 types worldwide, and your local lab checks for one strain. That is why we're not picking it up. So what do we have to do with testing? Expand out the strains of Borrelia. That is one of the first things we need to do with testing. One of the labs I use, they add the 297 strain, and I can pick up on Western blot Lyme-specific bands much easier. And even Johns Hopkins University found that the CDC 2-tier testing missed 55% of the cases. This is a study published in the British Medical Journal by Stricker in 2007. That ELISA Western blot combo only picks it up in about 56%. So it's about, again, a coin flip, right, that these testing is going to work. This was published by the New York State Department of Health back in 1996. They did a study with the CDC. Among 1,535 patients, 81% of the people who did not have EM bullseye rashes were not confirmed by the 2-tier testing. So let me state that again. If you did not have a bullseye rash, according to the New York State Department of Health and the CDC, according to the study they did, which is not widely spread, you have a 19% chance of picking it up on an ELISA and a Western blot. So it's going to miss at least half the patients. So then how do you know you have Lyme? Well, if you do a Western blot, And I call this Lyme bingo. If you have any one of those bands on a Western blot, those are Lyme bands that are very specific for Borrelia. The 23 is the outer surface protein C. The 31 is the outer surface protein A. Now, if you got a Lyme-Rix vaccine, that one could be false positive. Same thing with the 34, but most of you hopefully didn't have the Lyme-Rix. 39, 83, 93. These are very specific. So if you go into a doctor, and he's told you have chronic fatigue or fibromyalgia or multiple sclerosis, because you got those white spots on your MRI, right? But it's coming and going and it's migrating, and you've got these bands on a Western blot, you've been exposed to Borrelia burgdorferi. And I want to remind you that you're allowed to have two different things at the same time. You're allowed to have rheumatoid arthritis and get a tick bite, and you're allowed to have MS, although we don't quite know what that autoimmune disease is, and I'm going to give you some ideas. Demyelination, Lyme causes demyelination, Bartonella causes demyelination, they've associated chlamydia pneumonia with multiple sclerosis, low vitamin D levels, mercury causes demyelination. It goes retrograde up into your brain and causes MS lesions. No one is studying this, that there are multiple factors that may be causing demyelinating disease at this point. Doctors are not taught to think this way. And then you've got PCR's DNA testing, but a lot of times you're not going to pick it up. You need multiple tests, and you're going to hear later about the ELISpot technique, which is used in Europe, which may be another way of picking this up. Part of the other reason we don't pick it up is because these antibodies are bound in what's called immune complexes. That means that an antibody and an antigen comes together, and unless you dissociate them, you're not going to pick it up. And there were people from Stony Brook that were doing this test years ago on people with neurological Lyme disease, and they picked up 25% more cases when they did this type of study with dissociated antigens. And finally, the biology of the organism has a very long replication time. When you use penicillins or cephalosporins, it only works when the bug is replicating. If the bug is in a dormant state, you're not going to get it. Now, 10 to 20% of the Borrelia that are present in the ticks where we are not Borrelia burgdorferi, but the causative agent of relapsing fever in Japan, Borrelia miyamotoi. You're not going to test positive by an ELISA or a blot, and this, by the way, could explain some of the controversies again between IUSA and ILAC, because you may have other strains of Borrelia, which are not being picked up by these tests. And then you've got other tick-borne diseases like Babesia bartonella, also very difficult to pick it up. I was the first doctor to diagnose babesiosis in the Hudson Valley back in the late 90s. I had a patient come in a wheelchair who was sick for about 6 years. She cost New York State over $500,000 in disability. She was in her early 30s and she had day sweats, night sweats, and chills. And I said, anybody tested you for Babesia? She said, no. And they said, it's not supposed to be in this area. I did the testing and we found it. I gave her Mepron and Zithromax, and within 10 days she was walking out of a wheelchair. She's still walking and skiing. I went to the insurance companies and I told them about this. And they said, you cost us too much money, go bye-bye. And that is why a lot of your doctors do not want to treat you, because they're scared of being thrown out of insurance companies because they don't follow the guidelines by the IDSA, or because there are medical boards across the United States that are taking away doctors' licenses. They're shooting at the troops who are in the trenches trying to help you. This is how dysfunctional the politics of Lyme disease has become in the United States. And you need to know that, because it's not that your doctors may not know the science. It's because they're scared. And if we don't change the political atmosphere, no matter how much science I'm going to show you, it will not change stopping a worldwide epidemic, which is going to break the healthcare bank and make everybody sick at the same point in time. So when they say to you, gee, doc, there's no scientific literature saying that Lyme persists in the body, well, here's 6 studies, and here's 5 more studies, and here's 5 more studies, and here's 6 more studies, and you'll notice the last 2 on here. Straubinger, that was in dogs, found Lyme after 30 days of the kind of antibiotics you would take, and Monica Embers and macaque monkeys, same thing. And then Holly was referring to what's called a xenodiagnostic study in people, also in mice, but also in people with post-treatment Lyme, where they found in humans recently from the NIH the DNA of Borrelia persisting in the body, but unfortunately, when they published this, they did not say, because the reputations of all of these researchers has been based upon the fact that Lyme is not a persistent infection. But I'm here to tell you that I can save the reputations. Why? Because they were publishing on Lyme disease. What I'm going to show you today in the model. Now, it does persist in all of these different parts of the body that I'm showing you. It's all published in the literature, in the skin, in the eyes, in the ligaments, in the joints, in the central nervous system, inside endothelial cells, and even now in biofilms. Biofilms is what you've got on your teeth with the plaque at your teeth where the dentist has to take it off, otherwise the bacteria destroy your teeth. They're now finding biofilms in the body with Borrelia. The antibiotics are not going to penetrate into biofilms. And then another reason it may persist is because of what are called atypical or cystic forms. This has also been published in the literature that Lyme can persist and retransform into mobile spirochetes. And again, if you don't use drugs like Flagyl, tinidazole, I was the first doctor again to talk about Flagyl back in the late 90s when I presented at the International Lyme Conference in New York City. It's something that helps with some of the cystic forms of Borrelia. And finally, you'll hear that those double-blind placebo-controlled trials do not show that you got better. Not true. 2 out of those 4 trials showed that you did get better. The Krupp trial, your fatigue got better, and Brian Fallon's study down at Columbia University, your brain fog and your memory and your fatigue, everything got better, but the reason it didn't stay better is because the antibiotics were stopped, because it is a chronic, persistent infection. I've treated 12,000 of you. There is not even a doubt in my mind that when I treat my patients, I get them better, but not all of it is treating with antibiotics. The antibiotics are lowering down the load of the bugs in the body. I'm going to show you the other tricks that we use to get people better. And here's where the MSIDS map comes into play. If you don't just have Lyme disease, but you've got these other infections, let's say you've got Bartonella, the patients who have the worst nerve pain or the worst brain fog with memory problems who see me, if you don't treat them for Bartonella and they've got it, they're just not going to get better. If you've got Mycoplasma species, these are inside the cells, very difficult to kill. They cause autoimmune reactions and cause inflammation. If you have parasites like Babesia, Krauss published back in JAMA back in 1996 that when you get Lyme and Babesia, the patients are 3 times sicker and you can find the DNA of Lyme in your blood 3 times more often because Babesia is suppressing your immune system. So is Bartonella. These multiple tick-borne infections cause a suppression of your immune system, even though you have an overstimulation of other parts of your immune system at the same point. And then I find that there are other parasites in my patients, which have nothing to do with a tick bite, but Babesia suppresses your ability to get rid of other parasites. So if you have intestinal parasites, and Steve Fry in Arizona is finding parasites called FL1953, Protomyxoa rheumatica, he's told me that genetically there's 8 different parasites in this FL1953. I'm finding when I clear parasites from the body, some of your resistant Lyme symptoms get better. Again, not published in the double-blind placebo-controlled studies that are always being talked about by the infectious disease doctors and the rheumatologists. What about viruses? Well, you heard about the Powassan virus. The Powassan virus in our area was at 1 to 2% about 4 years ago. It's now 5 to 6% in the ticks. And it's deadly in 10 to 15%, up to 30% of the cases. So this is a reason why you really want to learn tick prevention. And finally, there's Candida and other fungi. I just started testing for mold toxins because we have a lab now that was approved in New York State, and I'm finding that 2/3 of my patients who are not getting better with some of the standard treatments are showing up with mold toxins in their body, aflatoxins, ochratoxins, trichothecenes. These are severe neurotoxins that make people tired and cause memory problems, give you nerve pain, and exactly mimic Lyme symptoms. And maybe another explanation, and doctors are not testing you or treating you for this. There are polymicrobial infections in ticks. This is what Holly is referring to. This is the TOCAR study that was done several years ago where they found not just Lyme disease, Borrelia burgdorferi, but Borrelia miyamotoi, the relapsing fever, anaplasma, Babesia microti, and Powassan virus. And I'm not just finding Babesia microti. If you go to your doctor, the people who raise their hands with day sweats, night sweats, and chills, you're not going to find it on a Giemsa stain, the stain where they look under the microscope for the parasite that looks like malaria. Unless your level of parasites in your blood is over 5%, they're not going to pick it up. That's why the Chinese government called me up 4 years ago, because the cases they were finding were not fitting the textbook definitions. What I'm finding is there are other strains of Babesia. I've now picked up from Winter Park, Florida, up to Maine, another strain of Babesia called Babesia wal1 done can I? Your doctor needs to test you for this, and it's done through LabCorp. It's done through LabCorp, it's done through Quest. 19% of my patients who have these malarial-type symptoms that don't test positive for Babesia microti are positive on Babesia well-1 done can I, okay? Big difference, and that is not being tracked at this point by the CDC. I don't even think they know about it at this point in time of how far these Babesia species have spread, and there's 100 different types of pyroplasms, Babesia-like organisms, and we're only testing for a handful, just like all these species of Borrelia, and we're only testing for a handful. Then they found Bartonella in ticks, both here in New York, New Jersey, and the Midwest, and Eva Shoppy and I have been working on a study at the University of New Haven where they're finding mycoplasma in ticks, Mycoplasma genitalium, Mycoplasma pneumonia, and Mycoplasma fermentans that's been associated with Gulf War syndrome. And here's the problem. Our armed forces are coming back, and many of these people who have served and given their lives are sick and suffering, and we don't have answers. And the MSIDS model may be the answer for some of these people, because I'm finding that it's not just the infections getting into them, but it's the toxins. When you look at this model, and I'm going to show you in a second, I'm going to show you how many toxins are getting into the body, and if your detox pathways doesn't work, you don't get better. So co-infections, not just Lyme, but co-infections, these other organisms are the rule. Ehrlichia, anaplasma, your white cell count may be low, platelet count may be low, liver functions may be high. Kind of like with Rocky Mountain spotted fever. Same presentation on lab testing. Bartonella, your nerve pain and memory problems. Treat these parasites, they get much, much better. This is the #1 co-infection that's keeping my patients sick. Again, not published in those guidelines that you'll always hear about. So if you go in with night sweats, here's the differential diagnosis. Do you have an autoimmune disorder? Do you have panic? Do you have tuberculosis? Do you have a cough and you're bringing up phlegm with blood? Do you have non-Hodgkin's lymphoma? Do you have hyperthyroidism? Do you have hormonal failure as a woman? In other words, doctors are supposed to do a differential diagnosis, and unfortunately this is not happening. When you tell your doctors day sweats, night sweats, and chills, that is what they should be going through to figure out why you have those symptoms. And unfortunately now we're labeling diseases, and doctors are not always thinking out why the symptoms are there. And then apart these co-infections like the Powassan, as I told you, the rate was 1 to 2%. It's now up to 5 to 6% in the Hudson Valley. In Vermont, 10% of the ticks are containing triple E, which is an encephalitis virus. Anaplasma in Vermont doubled between 2008 and 2010. 16% of the dogs in Vermont, according to the Vermont Department of Health, have Lyme disease. And there was a study just published by the Banfield Hospitals that 21% of the dogs in the United States, the rate just went up for Lyme disease last year. So the rate of Lyme disease in animals and dogs went up 21% last year across the United States in like 900 vet hospitals across the US. Does that mean we have an emerging epidemic? According to the CDC, once it goes over 5% in the animal model, you have an emerging epidemic. In Vermont, this was 16%, and last year in Banfield, 21% increase in Lyme. We have an epidemic, folks. We need to get on the bandwagon here and start looking at what us as clinicians and the academicians, we need to get together and we need a forum where the politicians, the insurance companies, everyone gets together so we can stop your suffering. Borrelia miyamotoi is this new emerging Borrelia species. As I told you, there are 100 different types and 300 types worldwide. We're checking for one in the test that you're getting. It's the first Borrelia species that's transmitted from the mother tick to the eggs without it having to feed on a blood meal. It does not have to feed on a mouse or a deer to get this, which means If 6 to 73% of the larvae of these infected ticks are passing it on, the next epidemic we're going to be looking at is going to be Borrelia miyamotoi. We found it in the Hudson Valley years ago. They just found it in San Francisco in the parks. They just found it in Canada. It's a worldwide, another Borrelia species that is not picked up by the standard blood test. And by the way, as women, it causes miscarriages. It causes hemorrhage. It can cause strokes. It causes bleeding problems. And it also causes EM rashes. So if you have a rash that your doctor says is Lyme disease, the answer is there are other organisms that can cause that type of rash. Borrelia miyamotoi and another disease in the Midwest known as star eye, southern tick-associated rash-like illness, we don't know the Borrelia species, will cause these type of rashes. And as Holly told you, only about 10 to 15% of patients even get a bullseye rash. Many times your doctor thinks it's a cellulitis or a spider bite because it's not that bullseye type rash. So we've got infections that are making you sick. Your immune system is overstimulated. You can have a false positive anti-nuclear antibody, go to your doctor and they're going to tell you have lupus and put you on prednisone and you're going to get much worse. Well, Lyme causes a false positive ANA. If I treat my Lyme patients, the ANA goes down. What about rheumatoid factors? You have a rheumatoid factor that's positive, you're going to be told you have rheumatoid arthritis. Lyme causes false positive rheumatoid factors. Now, how do you know it's not lupus? Well, if there are doctors in the audience, it's a test called a double-stranded DNA. How do you know you don't have true rheumatoid arthritis? It's a test called a CCP. There are markers for these specific diseases. So these markers of anti-nuclear antibodies and rheumatoid factors mean it can be an overstimulated immune system, and you're much worse if you're HLA-DR4 positive. But the key to why you're sick is inflammation. You have molecules in your body called cytokines. These are molecules that create a fire in your body. They're called interleukin-1, interleukin-6, tumor necrosis factor alpha, interferon gamma. These molecules is what causes you to be tired, have joint aches, have muscle aches, where your memory doesn't work, and you're moody, and you can't sleep. It's caused by these molecules. So if I can lower down these inflammatory molecules in the body, which we can, and I'm going to show you how we do it, and open up your detox pathways, we can get you better, even if we don't get rid of every last organism in the body. And then you've got all these toxins getting in. There are people with multiple chemical sensitivities. I'm finding a lot of heavy metals, a lot of mercury and lead, not on a blood test, but on a 6-hour urine test, using a specific test, using DMSA. We're now finding mold and neurotoxins. The problem is these all overlap your illness. People can have food allergies or sensitivities. I have a rheumatoid patient who's got rheumatoid arthritis and had a tick bite with Lyme. But when he's off his gluten, when he's eaten off a gluten-free diet, his knee swells up to 3 times the size. I got him off prednisone, I got him off Enbrel, I lowered his Arava, I treated his Lyme, but every time he's off his diet, his joint pain's worse because if you have food sensitivities, the same inflammatory molecules you get with Lyme and co-infections can happen from food. They can happen from these toxins. They can happen from nutritional deficiencies. If you're zinc deficient, you get this inflammation in your body. If you have a lot of free radicals, oxidative stress from infections, it damages a part of your body called the mitochondria that makes energy, but that's also responsible for nerve function and also your cardiac function. Then people come in with psychological problems because it's the great imitator, or every neurological symptom under the sun. Lyme even affects your endocrine system. I have 20-year-old men come in with no testosterone. And I was telling people yesterday when I lecture in France, the way that I get the attention of the French men is I tell them, you're not going to be able to make love to your French women. That gets their attention. Not that they're going to be sick and tired and achy, no. Tell them the hormones are going to be affected, then they start paying attention. Same thing with women, and also growth hormone, adrenal hormones. 40% of my patients have low adrenal hormones. Your adrenal gland is necessary to fight infection. It's a stress hormone. If you don't have adequate adrenal hormones, no matter how many antibiotics you take, they're not going to work. It's the nails in your foot that you got to find one by one that your doctor may not have looked for that's making you sick. What about sleep? Lyme patients don't sleep. How many people here can't fall asleep or keep waking up in the middle of the night? The majority of you. That's because Lyme causes inflammation, and when you don't sleep, it also causes more inflammation. One of those molecules called interleukin-6 goes up when you can't sleep, making the symptoms worse. then Lyme affects your autonomic nervous system, the part of your body that deals with your blood pressure, your pulse rate, your GI tract, your bladder. So if some of you say, when I stand up, I get dizzy, and I can't stand for more than a couple of minutes, and I have a lot of palpitations, and occasionally I feel like I'm going to pass out, Lyme may have affected your autonomic nervous system. You don't fix that with antibiotics. You fix that by bringing up the blood pressure with salt and with fluids and giving medicines like Florinef and Midodrine. But Lyme affects the body, and what was not published in the double-blind placebo-controlled studies is it's not enough to treat the infections, it's what the infection does to your body that also needs to be treated. Is this making sense to you? That is why people are not getting better. So you've got to address all the 16 points on this map, and that is the model for chronic disease that I hope to work with the CDC, with the NIH, with all doctors, NIH, everyone, so we can solve these chronic disease epidemics in the United States and get you better. And what this comes down to is that Pasteur's postulate that we were taught in medical school that there's one cause for one disease just does not apply. The advantage of this model is it's multifactorial. You've got many things overlapping at the same time, keeping you sick, and what's really making you sick is the inflammation. If you've got these inflammatory molecules in the body that's damaging your cells, that's what's causing you to feel sick. But also these infectious agents create toxins called neurotoxins, like foods and take out the heavy metals and detox them, get the hormones in balance, deal with the nutritional deficiencies. In other words, deal with all the nails that are in the foot. And this is the one common denominator that I was telling you at the beginning of the talk for all chronic disease.